And then if you're getting into the wildland fire side of things, especially in the medical piece, having that DoD style of training in TCCC and austere environments is huge. Being able to sit on a patient for more than 20 minutes, that's a big consideration for a lot of the city medics coming out here. It's like, bro, we're in the woods, man. I really don't know. I'm going to do my best to not intubate this patient. I'm going to carry a supraglottic and do that. And if they need an advanced airway, it's probably going to be a cric.
Yeah.
How are you going to sit on this guy overnight if we don't have a helicopter and we're spiked out? A lot of different things coming out of that military realm that directly correlate to the wildland side of things. But being a city medic, it's just different.
Makeshift tourniquets, right? We always hear people say a belt, which there's pros and cons to that, but also like your Nomex, you can cut a strip, you go get a girthy stick, and I've heard stories of people soaking them in water, pissing on them, right, to give them some rigidity, and then seriously, and then you can use that to crank.
When it comes to improvised tourniquets, like if you don't have one, obviously freaking do it, right? A tourniquet is better than no tourniquet. However, how much extra time are you spending taking your belt off, trying to find a stick, taking your junk out to go pee on it, like you just mentioned, right? So all these things is like, why? It's taking so much time. Versus if I just had a cat sitting in my cargo pocket, I can rip that thing out and have that tourniquet placed on that patient within 30 seconds.
When you're fighting wildland fire, you can't afford jitters, crashes, or brain fog. Fire from Miles Supplements is built to the demand wildland firefighters face. With natural caffeine, brain-boosting nootropics, and essential vitamins, minerals, and electrolytes, Fire gives you sustained energy and razor-sharp focus through brutal 16-hour shifts without any negative side effects. Whether you're hiking miles with a pack, having a line in the heat, or staying alert during night ops, Fire keeps you energized and mentally dialed in. Just mix 1 scoop in water about 30 minutes before your shift starts. If you're serious about performing at your best when lives and land are on the line, fuel up with Fire. Check out Miles Supplements at the link below and experience clean, powerful performance built for the fire line.
What's up, guys? Welcome to the next episode of the Spiked Out podcast.
Yeah.
I'm your co-host, Brennen, with Tyler, and our newest but far away co-host, Brennan Hill. What's up, man?
Dude, there's 2 Brennans now. It's trouble.
We need people confused, and we want to make a Tyler sandwich with 2 Brennans.
Hey, man, if you're drinking something, I got to get the little work beer out.
Yeah,
man.
LaCroix
action.
I got a C4 just for you. It's your favorite.
Well, we're very excited to introduce Brennen. He's one of our very good friends. We've done a lot together, been a lot of places together, a lot of fires, a lot of other random contracts, and he's one of the most interesting folks, and he's very kind and funny, and he's going to be a 10 times better podcast host and interviewer than
both of us combined.
Combined.
100%. No, we're super excited.
Well, let's.
I just have the gift of the gab. That's it.
You really do.
So where you at? Just so everyone, either listening or those that are watching, know.
Yeah, so you guys are in St. George,
Yep.
which I live there full time, and I ditched you after a day.
Yep.
I work for an agency cooperator along with doing the private contract side. I work for Dameron Valley Fire Rescue, small-time department out of St. George, Utah. I've got my task book open for FFT1 right now, and we've got 2 engines, so they took us both out. I'm on the Bridger Teton National Forest right now. I tried to get the Tetons in the background. I just don't have a high enough stand to do it, but it's awesome up here, man. So we got pulled up on a severity roll. If you guys don't know what that is, they'll take engines. A lot of the resources here got tied up to the Burnt Creek and the Dollar Lake fire right on the Bridger Teton. They needed some forest resources for IA, so they pulled up the engines, and so we've just been patrolling, looking for smokes, yelling at some campers who decided to have fires when they weren't supposed to. Nothing exciting thus far.
Nice, man. Yeah, there's a little bit of mountains in the background. It looks pretty sweet up there.
Oh, it's beautiful, man. If you guys haven't been to the Tetons, do it. Tyler, you worked here on the ambulance for a little bit, didn't you?
Yeah, that's right. In 2020, spent the summer working for the Park Service on the ambulance. Another thing I'd recommend any medic out there to start checking USA Jobs in December, I want to say,
it's
around the fall. Yeah, earlier than you'd think for these. Some of the parks, the bigger ones, do open some slots to medics. And Yellowstone, from what I understand,
Zion National Park does as well.
Yellowstone does EMTs. The Grand Teton was just medics only. So,
but most of these Fed opportunities they have to be posted on USA Jobs. I think it's important to say that because they have a relationship with the government, and so
I think it is the government.
It is the
USA
government.
Jobs.
They own it now.
Yeah, nice. I think they always have.
Nice.
But yeah, if you are trying to find Fed jobs, that's where you find them. And like we were just saying, you got to look. You're not going to get a job for next week on there usually. Like, for example, right now it is September 1st, and many of the announcements for next fire season are out now. So for 10 months from now, maybe 7 or 9 months, but depending on when you start, it's many months ahead. So
nice. Well, yeah, let's dig into a little bit of your history, Brennen. I'm super interested in your path into EMS, and then we'll go into some of your current endeavors.
Yeah. So let's see. I got my EMT basic in 2009. Then I took a very long hiatus. Went to college, found out that was a scam only after I graduated and spent a lot of money.
Yeah.
My undergrad was in public health with an epidemiology emphasis. Nowhere near exciting anything else. You're kind of just sitting in an office looking at data sets. But while I was doing that, I was a little ROTC cadet. So I actually commissioned as an officer in the Army National Guard. I was in the Guard for 12 years. When I was enlisted back in 2013, I did 68 Whiskey. So it's their medic. I was with the Field Artillery Unit for 4 years before I commissioned. Once I commissioned, I got into the intel piece and was trying to pursue some opportunities there that didn't work out. 2019, I decided to go back to paramedic school. And I've been history since. So I graduated 2020 during COVID. COVID messed up my medic program on a large scale. Wasn't ideal. Not at all.
No.
So getting out, I didn't really want to work just for a small time department right outside of St. George. I ended up picking up a contract, and that's actually where I met Tyler out in the ICU in New York City. That was the first contract I did. I know there's a bunch of guys in the contract realm that came out and did that. It was RVT. So what were we doing? We were CTICU that first. How long were you there, Tyler?
Yeah,
a couple weeks.
First, how did you even hear about it? That particular job.
Worst responders, man. I thought it was a scam.
Yeah, same.
I called the guy, and on the interview, I was like, dude, like, I gotta know, man, is this a scam? And he's like, no, I promise it's real. So I was like, you know what? F it. Like, I'll just buy the ticket to New York. If it's a scam, I'll spend a couple days there. I'll fly back home. It actually turned out to be legit. So worst responders, man, that was an awesome resource for just getting out and seeing what was, you could venture into the world in paramedicine for a contract side.
Yeah, shout out to them. Same story. Saw the post on Instagram, and it was like opening tomorrow, $900 a day. And just said, yeah, I'll go. And then it was real.
And I know, Tyler, you were in ICU.
Yeah, Brennen and I are both.
You guys were both in ICU.
It was a CTICU, which is a cardiothoracic ICU. I wouldn't have known any of this stuff before I got there, but basically where people go after they have a cardiothoracic surgery, heart, lungs, etc. But it was turned into people who are really fucked up with COVID ward. So it was kind of a depressing place after a little while. It just I think I was there for almost 4 months. There was a few patients that were there the whole time, bedridden the whole time. Yeah, but it paid
Oh, but
well.
they love Tyler. Tyler was in there massaging one lady who had been in that bed for what, 4 months?
Oh,
Yeah.
Oh, she loved you, Dad. I
Massaging's a
remember her
strong
eyes.
term. She was like goddamn not paralyzed, but wasn't ever moving. So I would just like lift her arm up over her head and like move it around,
it's a
and she
mobility
was
thing.
like in heaven, like she was totally bedridden. Yeah, that was an interesting time. God,
But you bring up one other good point earlier. You know, you said you went to college. It turned out to be not for you, waste of money, whatever it was. But also being in the military as a medic, what were the differences or similarities, or like being a medic in the military and then going and getting like your NR national, you know, not all those skill transfers. Some skills you can't even do, you know, you do in the military, but you're not doing as a medic. Like, what's that contrast like?
Yeah. So, I mean, here's the thing about the DoD, man. Like, it's the medicine piece there. If you are somebody who's solid and you've got the PT for it, you know, I was just a 68 whiskey. So that's the baseline, right? The
Mm-hmm.
healthcare specialist. They've got CLS, which is your combat lifesaver. I know a
Mm-hmm.
lot of guys have kind of been pushed into EMS by that. They get to start an IV or they get to do something. It's really cool.
Yeah.
Then you have the next level, which is your 68 whiskey or your combat medic. The whiskey phase, I mean, so it's a 16-week school. You have AIT, right?
Mm-hmm.
The first 8 weeks are all NREMTB. So you graduate with your National Registry EMT Basic. And
Okay.
then the next 8 weeks are the whiskey phase, where you really delve into crics, needle Ds. And once you get to your unit, they'll maybe let you do chest tubes. All just depends.
Mm-hmm.
It's a totally different realm, but there's so many awesome skills that translate from the 68 whiskey piece into wilderness medicine or care for patients in
Yeah.
austere environments. That I've been super grateful for. If you want to take it a step up, then you go become like an 18 Delta, or if
Mm-hmm.
you're in the Air Force, you go be a PJ, any type of SOCM, right? Special Forces medic. Those guys, I mean, they're the stuff that they know and the stuff that they can do out there in the field. It's awesome. It's incredible. Versus being a 68 whiskey, you really like are a subject matter expert on stop the bleed, right? Wound packing, tourniquets, getting some IVs started. Back in the day when I went through, so this was 2013, we even had like Hextend,
Mm-hmm.
which is a vascular enhancer. It's pulling fluid from other parts to try to put it in your vessels. I don't think we use it anymore, but it's a lot of stuff that you don't see in typical EMS.
Mm-hmm.
And then with the college piece, I mean, what I'm super grateful for with college is just the anatomy phys classes I got to take. Paramedic school for me was kind of a breeze,
Yeah.
just in the sense that you come in with a basic understanding of pathophysiology. You understand disease process. I took communicable, non-communicable diseases, medical term, all that stuff. If you're in college now, take those classes, and you'll come out. If you're going to paramedic school, like so much far or so much further ahead than your peers. A lot of the guys that were lacking a college degree or this is their first job, they're an EMTB, no experience coming into paramedic school. Those are the ones that definitely, and again, it's case by case, right? You can't paint a broad swath of people. But some students really struggled versus some other people just kind of have like the mojo to be a paramedic. It all
Yeah.
just depends on the person, in my opinion.
Yeah. And I mean, I know I did the CLS. You were talking about that. And
Yeah.
Tyler, you did CLS and
yeah, T triple
T
C.
triple C. And I guess I
Mhm.
didn't realize right away that you got your NREMTB like in the military, because it's not very common that you do a skill in any branch of the military and that becomes a transferable skill once you get out, like an accreditation. I think,
Yeah.
you know, the 68 whiskey and TB air traffic controllers there's very, very few that have those directly get out and go do something cool.
Yeah, you know, if you're struggling with the medicine piece, just know if you don't pass the NREMTB or the National Registry in medic school, you actually get reclass. We had a lot of guys go; they became 11 Bravos or they went into the artillery. It all just depends. But I mean, if you're looking to delve into the world of T Triple C, the DoD is a great stepping stone. It's awesome. You get so much experience, and then plus just being in the military in the first place, you have those lifelong friendships. I still talk to guys that I went to basic training with in 2013. It's
Yeah.
2025, 12 years. You know, it's a great place to be, man. I highly recommend it for a lot of people.
Nice.
Thing I find kind of funny is like in the Army or even the Navy, the corpsmen and stuff, they'll be like, I'm a medic, and they throw out the term medic, and then they come out into the civilian world and like, I'm a medic, and then we're like the business owners talking to you like, oh, you're not a paramedic, you're a military medic, which
is great in its own sense.
There's so many spectrums to that, because I served with some core people that, you know, I wouldn't want them showing up to my emergency. But when you're in the Marines or the Army, you're like, oh, do you think that's Doc? And Doc knows absolutely fucking everything.
Yeah.
But like everything, there's just levels to it. But some, you know, we get a lot of people applying to Minuteman like, I'm a combat medic and all that. And, but they're not a paramedic. Or never went to combat. And like now when I look back at some of the corpsmen I was around, some were really good, but some were like, they're an EMT basic, dude. Like with an EMT basic with next to no time on the ambulance.
Yeah. Or patient contacts. And maybe that's where the joke of change your socks and take Motrin comes in, is because it's the go-to
all they know how to
solution. It's all they know how to say.
But well, you know, I've got a buddy that's a 68 Whiskey 1. He's a Sock'em. He's a stud. But if you hand him a 12 lead, he's admitted as much. He's like, I don't know how to read this. Versus like as a civilian paramedic, that's our bread and butter.
Right.
However, if it came down to a cric, I'm like, dude, you got this, man. I don't do him enough. However, he's gone to live tissue labs every single year for a refresher, and he does it constantly. So, you know, just different skill sets. What are you planning on having as your niche? And then if you're getting into the wildland fire side of things, especially in the medical piece, having that DoD style of training in TCCC and austere environments is huge. Being able to sit on a patient for more than 20 minutes, you know, that's a big consideration for a lot of the city medics coming out here. It's like, bro, we're in the woods, man. You know, I really don't know. I'm going to do my best to not intubate this patient. I'm going to carry a supraglottic and do that. And if they need an advanced airway, it's probably going to be a cric.
Yeah.
How are you going to sit on this guy overnight if we don't have a helicopter and we're spiked out? A lot of different things coming out of that military realm that directly correlate to the wildland side of things. But being a city medic, it's just different, right? You most likely are going to be really good at 12 leads, a little bit more on your pharmacology. But you probably don't know much about antibiotics versus the special forces guys. They really understand that realm because they're taught it. So just it's nichey. Medicine is really nichey.
Yeah, no, that's a great point. It's what you take from each individual piece, and some skills transfer better than others, and others you just have to learn. You have to go out and find those skills.
Yeah. Well, how did you get into wildfire? How did you hear about wildland fire? What was your first job? And then
really, you don't remember? Oh, I'm so hurt. It was
for the
you.
Listeners.
So you and I were talking one day. It might have been after we had that lady that we did postmortem care on, and we were suctioning out those blisters. That was enjoyable. That's the only time I think I've seen you close to throwing up.
Yeah.
But you're like, have you ever heard of REMS? And I was like, what? No, I have no idea what that is. So we worked I called up Stephen McDowell. He was our REMS lead over at Fireline Medics back in 2021. I told him, yeah, I know knots. I did air assault school in the Army when I knew like 4 knots. But he took me anyway, which I'm super stoked on. And then we learned, I mean, everything that first year, dude. It was awesome. It was all press sticks and pulleys, like the old school style equipment. Steve had that big background as an alpine climber, so he was really not into all of the extra little ultra lightweight toys that we kind of use now for rope systems. But just learning how to pass a knot on a double prusik and a pulley, like that was a solid foundation. That's all I kind of needed. So getting into it, man, I ate it up that first year. I loved it. I'll be honest, as a wildland firefighter, I didn't know dick. I had no idea what was going on. I really I was thinking about this the other day, kind of talking to one of my guys. It wasn't really until like year 3 in wildland as a REMS guy where I really felt that I was bringing enough to the table to really be like a leader and kind of earn my seat there in the operations piece of the wildland realm, especially when it comes to a med plan and everything else. But that first year, man, it was awesome being able to learn from guys that had more experience, just pulling out the ropes every day, getting hands on systems and just drilling, 3-to-1s, 5-to-1s, knot passes, lowers, raises, you name it. It was rad. And then, I mean, what? I'm in year 5 now. A lot of opportunities that I didn't know existed in the wildland realm are kind of popping up. Been hanging out with some helitac crews, been teaching them some stop the bleed classes. Helitac is another realm that I think people really need to be aware that exists and how to get into it. Repellers, jumpers, I mean, you name it, right? There's so much opportunity out here.
Very interesting. You mentioned stop the bleed, so you do teach stop the bleed classes. Will you tell us a little about the importance of stop the bleed? And then also, I'm curious what you think should be carried medical equipment wise by the individual firefighter up to like the engine, the crew, etc.
Yeah, like on your person or left in the buggy or with that specific medical person on those crews.
Yeah, for sure. I mean, tourniquets are number one, right? When I started the Stop the Bleed class, I've kind of got this living document, this product I've created, where it kind of applies to just certain communities. I have one for the public. I've been teaching some gun stores and some gun ranges, one for the range. But then the one that I've put the most time and effort into is definitely the Wildland product. We're working around saws every single day. We're working in austere environments where we might have active fire line. So helping the guys understand, like, hey, if you have a major laceration due to a kickback on a saw and it's junctional, right? If you catch it on the neck or the armpit, maybe you're just underneath your traps or your chaps in your inguinal area. That's not even a tourniquet, right? Now we're talking about wound packing. How are you going to wound pack that and then actually secure it in place so when the REMS team shows up or someone with a quick litter or a Stokes, how are you going to make sure that you're able to transport this patient to where they need to go without that coming undone and continuing to bleed? So, I mean, what we usually do with our stop the bleed, especially when in terms of wildland crews, is we'll kind of take a whole day. We'll go over like a basic anat and fizz where I want the guys kind of coming out a little bit smarter than your average bear, understanding what arteries are where, what we're looking for in arterial bleeds, what warrants a tourniquet, what can you take care of with direct pressure or wound packing, and then just how to secure that. So we'll take that whole morning. We'll do like this PowerPoint presentation. We'll answer questions. We'll go over anat and fizz. And then in the afternoon, we're going to be doing some hands-on. I bought a bunch of Focus Research wound cubes. They're awesome, super expensive. I reached out to them. I'm too little. They wouldn't give me a discount. I'm like, fine.
Not yet.
I get it.
We'll work on it.
Yeah, no, they're like, the DOD buys our stuff full price. I'm like, I know. I don't have that money.
I'm not the DOD.
But what they do is they actually bleed, right? So actually having that a little bit of stress inoculation, understanding like how I'm keeping my pressure inside that wound while I'm trying to continue to pack, it makes a huge difference because you realize like, oh, I didn't put enough pressure on that injury point on that vessel, and that continues to bleed while I'm trying to pack it. So being able to get the hands-on there, we go over how to wrap junctionals. So anything on the neck, axillary, or inguinal, we're just using ACE wrap, right? That's something I picked up out of the military. Yeah. And then how to package patients.
Well,
once we get all that done, go ahead.
No, I was just going to say it's also important. Like we go out and not a lot of people just in general know how to use a tourniquet, yet alone understand the difference of when a tourniquet is no longer applicable and you need to be packing. And, you don't have a lot of time, obviously, right? If it's a severe bleeding, it's a decision that you need to quickly identify and then start that treatment. And yeah, just the education portion on it for every wildland firefighter. We talked about being your own rescuer, right?
Yeah.
Medical is at best 5 to 7 minutes away if you're close to the road. So those are super important things.
I think the crews get a little lulled into a false sense of security because there's line medics on the division or there's a REMS team and an ambulance, but like you said, we're not close a lot of times. Sometimes we are, but when they're doing project work in the wintertime, we're not close. You know, when your everyday life, there's not a line medic with you when someone could have a catastrophic bleed. So
yeah, it really depends on the fire. I've been a single medic covering an entire division where we've got 200 personnel on ground. I'm not going to be anywhere fast at all, especially when it comes hot shots, they're dialed. All the hot shot crews I've worked with, they really are self-sufficient. They know what they're doing. They've trained on it. But then you talk to some of these type 2 IA crews, and I'm like, yeah, let's see your med bag. And the thing has
It's a
been open in
Walmart
10 years.
first aid kit,
Yeah,
essentially.
man, you like try to open some gauze and it's just like dust. You're like,
Oh boy.
my favorite 4x4 dust.
Yeah.
I think they're
So it really is a thing when nobody knows what's in there either, right? They're like,
Right.
I think I have this. I'm like, does anybody have a tourniquet? And they're just like, no. And I'm like, dude, and those are the type 2 IA crews that I'm really worried about. A lot of these guys just got their Sawyer, right? Or they just did their 212 class and now they're coming out and they're cutting trees. Those are really the ones that I think are a lot more prone to saw accidents, and they really need to understand, stop the bleed. But a lot of guys just it's not on the forefront of their minds. Obviously, we have our own personal bias working in EMS where I've got a tourniquet on me at all times.
yeah.
But trying to instill it into those guys and then trying to give them a little bit of clinical judgment in that class where they're like, okay, like, do I need to do it here? I mean, it's not, we're still front country in a way. We're still CONUS. I'm super comfortable with tourniquets out here, unless all of a sudden you do have that overnight patient where they're going to be wearing that for, up to 14 hours. But hopefully that medic is there to understand. And man, like that's not something civilian EMS providers do. We don't do tourniquet conversions. We get them to the hospital, and it's a trauma surgeon problem.
Yeah.
So there's a lot of cool classes out there, but sorry, I'm getting off track. To go back to what I think Wildland guys should carry, definitely tourniquet, a hemostatic of some sort. Let's go ETB, and then if you've got it within your protocol, having an auto injector for epi, I think that's a huge one. Some crews do, some crews don't. There is the OSMP, which is the like Forest Service side of like your medic, right? So they're usually like EMTAs, and they understand like, okay, this is what EpiPen does. I've seen a lot of those out here where that's super useful. And then, I mean, depending on what state we're working in, California, Oregon, definitely carry some Narcan, some of the preloaded IN ones.
Now
That'll do you some good.
This tourniquet, Brennen, and this auto injector epi you're talking about, should this be in your truck, in your tent back at camp, or where should it be?
What a question, dude. Get this ready.
Yeah.
Mystery Ranch makes a hotshot medical lid where you can actually just clip it onto your pack, right? So if it's at your truck, you're kind of up the paddle without or you're up the creek without a paddle.
Yeah.
You got to take care of those because somebody can exsanguinate within a couple of minutes of having a serious arterial bleed. The Dutch Creek protocol, I don't know if you guys have talked about that yet.
We did.
But the Andy Palmer story out of California, which was the inception of REMS, that was the whole issue. Is the guy had femoral and artery involvement with a tree strike, and the kid ended up bleeding out before they could get him and then coded in the helicopter. So, I mean, had somebody had a tourniquet and had the wherewithal and the knowledge and the education training to put that on there, it might have had a different outcome. I wasn't there. I can't armchair quarterback the thing, but that was something that came out of lessons learned was, hey, we need a medical resource to rapidly move patients and somebody with the training to do so. But if all the crews are trained up on tourniquets, that'll definitely help single resource medics out there on the line.
Yeah. One thing with tourniquets, I think I want you to talk a little bit about is some different kinds of tourniquets, right? Because you could walk into some of these outdoor stores and get the Velcro with a plastic clip, and then you see ones online that are like $80 new, ratcheting type. What do you carry? What do you recommend? What should people stay away from?
Yeah, that's a good question. So, I'd always tell people stay away from no-name brands. If you're going something with COTC that approved, COTC is the committee of TCCC. They are the ones that kind of give like the golden stamp of approval that say, this is a good tourniquet. You can use it. It's like cat tourniquets. Those are the big ones that everybody sees that have the windlass on it. Those are great. If that's all you know, watch some YouTube and go take a Stop the Bleed class. I carry personally just this Rats tourniquet. It's super small, just unfurls. I like it. It doesn't take up any room in my pocket. These work great. So there's, probably 6 different tourniquets off the top of my head I can think of. Yeah, you've got those ratcheting system ones. There's some like a SWAT T
The Cat
that
2.
or it maybe has a metal windlass or a soft tee. The SWAT is something that just looks like a giant like ace bandage, but it's made out of rubber,
Mm-hmm.
and you just wrap it around. So whatever you carry, just make sure that you are trained on it, you know what you're doing, and then any extremity hemorrhage, like you're good to go. Stay away from anything that's no name. Like I mentioned earlier, Amazon is kind of infamous for that. You know, people are buying these tourniquets from some probably China, and it just doesn't work out when you try to put those on, and the buckle breaks on them.
Mm-hmm.
Go on a North American Rescue, spend the money, get that done, and then just carry it with you in your pocket, and like you're going to be more prepared than most of the people out here.
Now, though, that tourniquet in your hand right now, weren't those a bit controversial a couple years ago that they don't fucking work? Like, or what's the
Probably
scoop on those?
You know, I'm not super familiar on the data with them. I've had super good luck with them. You just throw this around, and then this is self application to tie this thing off. You just pop it into this little cleat over here. So again, look at data sets. Dude,
Look at that AC vein.
it's starting to feel a little tingly. It's working. You like that?
Well, and I think
drop what 18
you did
gauge
just there is great, right? People don't know. You can throw a tourniquet on your arm, throw a tourniquet on your leg. Yes, it's going to hurt a little bit, and then get a distal pulse, right? Go down to your wrist, go down to your ankle, and you'll be able to physically feel if you have a pulse or not. And so you kind of generally know this is how tight I have to tie it to get the bleeding to at least slow down, yet alone stop.
And some people are. This was taught at that WEMS class or conference we went to. The question of, well, should I be training with my real tourniquet? And that gentleman there said these tourniquets are tested, I think 500 times or something like that, or rated to 500 cranking
like full
sessions
and break,
if you will. So,
cranking sessions.
Yeah, don't worry about it. Just crank it as much as you need. You're going to be fine. It's better to practice than not, but
don't leave it on for hours, but you can have it 10-15 minutes isn't going to hurt you. It's going to feel weird, your arm's going to get tingly. Like I said, you can feel that pulse.
We'll have to look into that rats one. I know this was a couple years ago, but I was hearing some shit about them, but they are small, and some pressure on the artery is definitely better than none. So, but yeah. I do have a kind of funny / sad story about my first ever S212 class, which is the chainsaw course that I went to. We were talking PPE, chaps, gloves, eye pro, ear pro, all that. And the instructor's like, any other PPE anyone can think of? And I'm the only paramedic in the class. I was like, I think you guys should have a tourniquet on you in case you cut yourself and you end up bleeding. And the instructor, with a bold face and 100% seriousness in his eyes, said, nah, man, if that happens, you're basically dead, or something along the lines of, there's no point. If you cut your femoral artery, you're going to die. And I was so flabbergasted.
And that proves a point, though, doesn't it?
This was in 2016 or something. So I hope to God that he's not still out there thinking that way. But we got in a verbal altercation in front of the whole class about this. I was like, dude, what the fuck are you talking about? Like,
you're just going to give up?
So many men have died for us to prove that these things work, you know, with all the GWAT stuff. But so there is still some shitty dogma out there. And same with like losing the limb. Like, well, would you rather lose your fucking limb or your life? And we know you have many hours. Many. So
and there's pharmacology that you can do later on to save the limb. Like, it is not worth losing your life for whatever stereotype you have on a tourniquet. Like, your blood's important.
Yeah. So
yeah, understanding the anatomy phys behind it is we're trying to compress that artery. Because Tyler, you got a story working on the res with some EMT who decided to use a different type of tourniquet, right? Did I remember that accurately?
Oh yeah, that was. I wasn't there. I was working on the Rosebud reservation, and we were doing IV stuff, and I said, "Will you hand me a tourniquet, like the little blue elastic things for starting an IV?"
Like an IV tourniquet.
And he's like, "Hey, we don't call them that here. We call them elastic bands or some shit." I was like, "Why?" He's like, "Well, because they had a gunshot wound, and they had a new EMT, and the medic said, "Hey, sorry, put a tourniquet on that guy's arm because he was fucking bleeding, right?" And the medic went to do medic things, and he turns around, and the EMT put a blue IV elastic band on the guy's gunshot wounded arm. So there they had the little protocol. We don't call those tourniquets. That's a venous restricting band or something.
Help, it's still bleeding. What did I do wrong?
It's not working.
Dude, that cracks me up, man.
That's quick question with your training with Stop the Bleed. Do you ever teach or preach on makeshift tourniquets, right? We always hear people say a belt, which there's pros and cons to that, but also like your Nomex. You can cut a strip, you go get a girthy stick, and I've heard stories of people soaking them in water, pissing on them, right, to give them some rigidity, and then seriously, and then you can use that to crank.
So I actually have in my presentation like a slide with a study that they did where they were comparing commercial tourniquets to improvised tourniquets. Commercial tourniquets had a 100% success rate versus the improvised tourniquets had a 40% success rate. And this was hundreds of them. I'd have to dig back into the study or have it in front of me to really tell you like what the sample size of it was. But when it comes to improvised tourniquets, like if you don't have one, obviously freaking do it, right? A tourniquet is better than no tourniquet. However, how much extra time are you spending taking your belt off, trying to find a stick, taking your junk out to go pee on it, like you just mentioned, right? So all these things is like, why? It's taking so much time. Versus if I just had a cat sitting in my cargo pocket, I can rip that thing out and have that tourniquet placed on that patient within 30 seconds. So, I really harp pretty hard on carrying commercial tourniquets. But if you need to make an improvised tourniquet due to the situation you're in, then absolutely go for it.
Yeah, no, it's great point.
Don't be fucking cheap. Own a real tourniquet. And on the improvisation piece, you should know what your improvisation, if that's a word, would be before you are on the spot and you have to come up with something and know how they work. That is kind of funny. I always carry a tourniquet, but then I always keep a cloth belt on me that's like an inch or two. So if my tourniquet number 1, the commercial one that I keep in my appendix carry, if that doesn't work or I need some more or there's a double limb incident or a mass casualty type of thing, I know my belt. So I've thought ahead on what my improvised tourniquet would be.
You have a pace plan for tourniquets? I love you, dude. Wow.
I do. So, and there are some little nuances in real tourniquet versus a makeshift one, mainly like on a real one, when you're pulling that tight, you have to pull as tight as possible to start and then crank the windlass. But on your improvised one, there needs to be a little slack in it in order for the windlass to work. If I crank this belt all the way down on your leg tight, there's going to be no windlass action. Exactly. So don't be fucking cheap. Get a real one. But if you don't have a real one, know the little nuances in improvising.
And make sure your buddies have one too, right? Because if you and I are out, we're two fallers or whatever, and you go down, I'm using your tourniquet first because I could still become a patient. Make sure you know where everyone else is. It's always in your left cargo pocket, right? Or it's in this bottom pouch, like you mentioned, the Mystery Ranch clip-on med pouch. It's not just one person on the crew has it. It should be quite literally everyone who, my opinion, has a red card, goes out to the line, should have one.
Yeah, definitely.
Swampers and Sawyers for sure, man. And, it just comes down to the crew and having their own SOPs and pre-planning this. But it just comes down to education as well. If you're a brand new FFT2, it's your first year, first season, and you're coming in off of the street with no medical training. And all of a sudden, like having some medic come up on the line and say, "Hey, let's do a little hip pocket training on tourniquets." That's dope. That's cool. I wish more people would do it.
Yeah, absolutely. We probably are just waiting for some sort of tragedy to happen for this to actually get enacted where everyone has one or something like that. Yeah. So if anyone wants to sacrifice their life and bleed to death for the cause before we get some mandated tourniquet carrying protocols out here, that'd be great. Anything else on that? I mean, I'm sure in future episodes with Brennen, we're going to dive more into to medicine and common IWIs and for medics and for non-medics.
Yeah, no, I think we can roll into your company, Red Desert Rescue, and some of the stuff you're doing there and the training classes that you go and teach. We touched a little bit, but yeah. When did Red Desert Rescue come about?
So I mean, we're small. I started it in 22, but it really didn't take off until this year. I brought a nurse practitioner on as my business partner. His name's Justin Gomez. He's actually on the Monroe Canyon Fire right now on a med mod. What we were trying to do was bring medical support trailers, or MSTs. So there's two new terms out this year. MSUs, which is your medical support units, usually UTV with paramedic and an EMT as a minimum, and then a Stokes basket with some type of patient transport capability on that UTV. They're strictly there just for the medical piece, right? Some of the guys are REMS dudes, so they may or may not carry ropes and know how to do that. But what we brought to the table was MSTs, the medical support trailers. What we were trying to do with them is bring capabilities outside the realm of the paramedic to the wildland fires, right? They're becoming more popular. I saw them a couple years back, I think in 2022 on the mosquito fire. It was my first time I saw one. They're really big in Region 5. You're starting to see them kind of pop up in other regions. It really depends on the team and the Med-L if they want to order one or not. What we did do is we looked at the scope of the paramedic and said, okay, we have a mid-level provider now, a nurse practitioner. What can we do that these guys can't? So when it's coming into sutures, antibiotics, anything that you would need outside the realm of traditional EMS, we're trying to provide that capability on a wildland fire. I've seen a lot this year out here in Region 4. Madison County, they are a fire department in Rexburg, Idaho. They've got one, so that's the only agency cooperator one I know of. But then there's a lot of contractor ones.
Yeah, they're starting to
Adventure Medics, Frontline EMS.
Mountain Medics has.
Yeah.
Yep, Mountain Medics has a bunch. NIMS. Who else?
Oh, there's a ton.
Yeah, a little tarp. But there's a ton out there.
It's a good point, right? Because there are expanded capabilities within a trailer that you can do, like you mentioned, sutures, antibiotics. That normally, say it was a type 2 crew that got inhalation from burning poison oak. They used to have to go into town to an urgent care, get a steroid shot, and come all the way back. Oops. And being able to keep those resources on the fire line, not necessarily taking completely out of the fight for some of these, not minor, but easily fixed,
Well, it comes down to quality of life out here too, right? I mean, I saw a kid last fire who had double ear infection. I don't know how that happened, but he went in and they gave him some amoxicillin and he was back out on the line, having some antibiotics on board, and he was good to go. That's not something that, paramedics carry around with us.
Right.
So having that type of thing where, guys are getting their feet wrapped there all the time. They're coming in, or even in-camp emergencies, we're fully ALS capable there on the clinic. So if somebody is running a code in camp, we've got more capabilities on there.
Even
IOs,
prolonged
intubation role, everything, versus just what's, sitting in the med tent with a 100-man kit. So it's an awesome capability. I think it's just taking a little bit of time to kind of catch on. And then it comes down to medicate. Oh my goodness. English is super hard today. Education for the Med-Ls and why they want to order it. And I think it really needs to kind of earn its place in the wildland fire before you start to see them ordered every fire.
Yeah. You just said the word cooperator. What is a cooperator versus a contractor versus an agency?
Yeah, for people wanting to get into it. So you have agency cooperators, right, who I'm working with right now. These are going to be anybody that's like a municipal department, the feds, anybody that's not the private side versus a private contractor, which is a private company. Generally, they're for profit, and they create their own standards and protocols versus if I go out with Dameron Valley as an agency cooperator, I'm operating within the protocol that's already set by the medical director in our EMS system at home. It's a different ordering system. So agency cooperators really we work pretty well within the state because it's the state resources that are ordering us. Versus the private contractor side, you're going through the Ames office, you're going through the Viper system. It's all different. So if you see anybody out there wearing like a department shirt, Truckee Meadows is a huge one. Anybody from Reno that have some type of fire logo on there, and they say I work for a department, that's going to be an agency cooperator.
Yeah, and the feds order themselves first, and then the cooperators, fed, state cooperators, and then the contractors were the fucking scum of the earth, bottom of the barrel. But
it makes sense for the structure of how fires work. It makes sense.
Very needed. But yeah, so that's what a cooperator is. Maybe you're interested in wildland, but you want a more stable career choice. You could get a taste of wildland by working for a structure fire department that has some wildland urban interface, or does go on regular wildland assignments.
Well, there's departments out there that have like specific sole designated wildland programs. So Dameron Valley is one of them. In fact, like Dameron Valley, our wildland program kind of helps run the rest of the department just because we're so small. Hurricane Valley in Utah, they have another. So if you want to get on with the fire department and go do wildland, they have wildland specific programs where you can do strictly wildland. Draper up in Utah, or in like northern Utah, they've got a pretty dope engine up there that goes out specifically on wildland roles. So if you want to get on and go through the fire academy and be a firefighter for that department, and then you have interest in getting into the wildland realm, go say, hey, I want to get on the wildland roles, and they'll be like, perfect. Or you could just apply specifically to the wildland program, kind of like how Hurricane Valley does, or Dameron. Hop on, and you don't do the structure side of things, you just do wildland.
Yeah, that's cool.
And you can do both, right? You're a prime example. It's very hard for those that are contractors. It's super hard to get task books open to get these sign-offs for these different skills. So consider, having a agency close to you or that you like to go maybe early in the season. You get out early, you go get a bunch of sign-offs, you can progress your wildland fire career. And then if you want later season, September, October, go do contractor.
Yeah, it's perfect. I mean, for me, all my qualifications that I'm earning here at Dameron Valley are going into IQS, which is what the state has and the federal government has as a record of all of your qualifications. It's a lot easier to get task books signed out here on the agency cooperator or federal side with federal task books versus trying to open one as a private contractor. Especially, it's especially hard in the medical piece, right? REMS guys, I mean, some of us have been doing it for 5 to 10 years and they're studs. They know a lot about fire, but they're just an FFT2 on their red card. And that's obviously changing with the new WCG, the PMS 552 document that came out. Now they want to see single resource boss or FFT1 this year at a minimum for REMS teams to go out and to be that lead.
That makes sense. There's a little bit more, when you have an IWI or you're running a team like that, you need to know how to call in a helicopter. You need to know how to find your coordinates and communicate properly. So there's valid justification for these expanded leadership certifications within the contractor world. But it's hard to get those.
Yeah. Well, like what you said about how you can go work for a cooperator or even a federal crew, like you could go do some of the ones more in like the Southwest pick up a little earlier, maybe I don't know, March, April, May, but then they're done earlier too. Maybe some of them are done in September. So we've had people come work for us who went and they were hot shotting and then their crew wrapped up in September and then they came out and got a role as an EMT in October and still got a month of fire, getting paid better to do less. And so that's just a strategy some people could employ. If you want to be a firefighter, go do it. But then you might get some of that late season action with a private medical or private engine, all the rehab roles at the end of the year, which sometimes are kind of the nicer assignments. There's not a lot going on, but you're put up in hotels and you got per diem for food and something to consider if you want to maximize your season. Just because you're state or fed crew is done doesn't mean you have to be, assuming there's still fires going on. We'll see what happens here this year.
Yeah, I know. It's rough. Not enjoying the rain, but whatever.
So we can probably wrap up here pretty quick, but just since I've never really been a firefighter before, the way you're being right now, when you're on your severity assignment? Like, what's your role? What's
the day to day?
Yeah, are you at a fire? What happens if there's one in your area? Like, why are you there? And why isn't there a big column of smoke in the background?
So right, with the severity roles or the support code that we're on right now, this one's a little different. Being on an engine, you could get pulled onto an incident where you're actually doing incident engine stuff. But what we're doing right now is that we're kind of like backfilling the forest, right? They had a lot of these resources tied up with two larger incidents out here on the Bridger Teton. So we're patrolling the forest every day. We're looking for smokes. If an IA happens, that's going to be us. So we've got our radio on. We're available by cell. Depending on where we are in the forest, we might have to leave, head up north, go catch an IA. The forest does have their own engine, but they're off yesterday, today. Sometimes they get taken out to larger incidents as well. So we're really here just to support the local forest. We got lucky, man. The fact that we're in Jackson Hole, we actually are getting paid per diem. We're hoteled up. We're just sleeping in a bed every night. We wake up around 6. We go do PT. Then we show up to the district office. We talk to the duty officer. It could be the FMO or the AFMO, the fire management officer. The guy we've got right now, we've been working with the FMO for the past week. They just switched duty officers for the past couple of days. He's one of their operations guys. It's been super chill. We go out and we patrol, looking for IAs. We have dry lightning come through. We're going to be the ones that are actually going out and doing the fire piece on it. And then sometime around 1930 or so, we've been kind of rolling back up into Jackson. We are right next to the cache, so it's been kind of cool because I got to see the back end of things. We've been filling gas cans, we've been moving pumpkins, we've been getting everything ready to go out to some of these larger incidents. We are packing sling loads some mornings just to get the resources out there that are needed. So severity is weird. It could be that you show up on the East Coast and you're hoteled up every single day for your minimum 12s. Which is not the best. But out here, what we're doing, we're just patrolling the forest, getting off on all the little offshoots. Again, like I mentioned, campers and hunters, they've been having fires, even though we're in fire restrictions right now. So just managing the forest as needed. Our other engine went to Kemmerer, Wyoming. Brutal, man. It's balls down there. It's not enjoyable. Versus we're out in Jackson. So you could get lucky on a severity roll. You just never know. We've been doing some PT with engine 341 guys. We hiked up to the top of Snow King, which is rad. Took some saws and some Dolmars up. Every severity roll is different. If things were super slow and they said, hey, we don't need you anymore, they already told us that, like, hey, we'll just put you onto either Dollar Lake or the Burnt Creek, and you guys will go act on an incident as an engine.
Cool, man.
Yeah, that's super cool.
Well, anything else you'd like to say, Brennan Hill?
Oh, so many things. Come to my Stop the Bleed class.
All right.
Then you'll really hear me rant a lot more. So, this year I'm really hoping to get out and do some more traveling. Tying in with the Helitack cruise has been awesome. We're looking to see who else might be interested in what we have to offer. Again, guys during their critical periods, they're kind of crunched on time. So it's awesome for us when a crew does say, hey, come out, and they see that the product's definitely worth it. Not only are we doing Stop the Bleed stuff, but we'll generally throw in some woofer training. I'm working on my woofer instructor as well. It's kind of been a process. But your wilderness first responder. So we're talking about looking at reducing dislocations in the field. Again, you got to have it cleared within your protocol. Or if you've got a guy with a distal or lateral patellar dislocation, it's like, dude, this guy can hike out if we know how to reduce this. How are we doing splints with sticks and triangle bandages, stuff that we're going to have sitting on the ground and around and maybe in our packs? So we're really trying to hammer pretty hard on the austere medicine piece and just doing what you need to do to get a patient extricated and out. So we'll see where it goes this year, man. I'm really trying to set up a lot more trainings, and then just trying to get out and to travel to go do that.
Hell yeah. If any of you guys listening or watching want to reach out to Brennen, He is on the Journeyman. You can search for him there. Some of his trainings that are open to the public will get posted there as well. Where can they find you on Instagram or a website as well?
Yeah, Instagram is Red Desert Rescue, just all one word. Pretty self-explanatory. I'm trying to work on the feed, so it's kind of bare bones right now. But if you guys, we have a website too, just reddesertrescue.com. Go on there, and there's a couple of places you can actually just like throw in an email to us, and we'll get it and respond.
Hell yeah, man.
Yeah. Be that advocate for your crew if you're listening to this podcast. And even if you're a second year guy or something, maybe you should advocate to your bosses like, hey, let's bring this guy out and do some stop the bleed. I've seen you teach. You're really good at it. So it would be very worth any of these crews' time to have you come out and do some training. It's important.
Yeah, and we try to tailor it as best we can. You know, if crew says, hey, we really want to train on this, or we have questions on X, we're there for it. I brought out Justin with me, my nurse practitioner, business partner. And I mean, dude, he's just a wealth of knowledge, right? So if you really want to get into the nitty gritty, we can do that. But again, we really try to, or our aim is to just equip these wildland crews with a little bit more training and education where they have good judgment and they know what they're doing when it matters most.
Cool. Yeah. Well, we appreciate your time, Brennen. We're looking forward to you getting back and joining us on future episodes and interviews and all the shenanigans we get into. So thanks, man.
Yeah, dude. Stoked. Thanks for having me on.
Yeah.
Stay safe, brother. We love you.
Thanks, dude. Love you guys too. Okay, bye.
Bye.